Hello, I'm Dr. Stephanie Young, Senior Consultant Oculoplastic Surgeon practicing at Eagle Aesthetics and Surgery. After doing eyelid surgeries for 10 years, I hear similar questions from almost all my patients before their procedure. Whether you're scheduled for surgery or if you're looking for surgery, keep watching the video to get your questions and doubts out of the way. Question 1. How do you know if I'm a good candidate for eyelid surgery? I will evaluate every patient individually to see if they are a good candidate for surgery. This means I will examine their eyelids and discuss the overall goals with the patient so that we will both know exactly what the surgery will involve and what the objective is. For example, if a patient shares that they are unhappy with their monolids and wish to have double eyelids instead, and want to keep it looking natural and scarless, we might discuss the option of suture or mini incision blepharoplasty rather than the traditional full incision blepharoplasties. For almost all patients, I would assess the height, shape, and symmetry of their eyelids, as well as their skin thickness and muscle tone to determine the best approach depending on their anatomy and preferences. We aim for results that look harmonious with the patient's facial features. Additionally, I would check for any pre-existing eye conditions, such as dry eyes or eyelid ptosis, that could affect the outcome or recovery. Another common question: is eyelid surgery painful? During eyelid surgery, patients are typically under local anesthesia with or without sedation. With sedation, it means that they are in a relaxed and drowsy state, but can be awakened easily when needed to check their eyelids. The sedation helps ensure they feel calm and comfortable throughout the procedure, while the local anesthesia numbs the area completely. Patients usually do not feel severe pain during the surgery. At most, they may sense some light tugging or pressure. Usually, we will prescribe some pain medication before and following surgery and follow up if any discomfort arises. Most of our patients, however, actually do not even need their pain meds after the first day. Most patients actually tell me how surprised they are at how little pain they feel during the surgery and after. A third common question: can you take me through the process of incisional blepharoplasty? Of course. I begin by marking the ideal crease position based on the patient's eye shape and desired outcome for symmetrical, natural look. Local anesthesia is then administered to keep the patient comfortable and pain-free during the procedure. A precise incision is made along the marked crease to adjust the eyelid's underlying structures. Depending on the patient's needs, I may remove excess fat, reposition the fat pads, or tighten the muscle layer for brighter eyes and a well-defined crease. Finally, fine sutures close the incision, shaping the new crease while ensuring minimal scarring, as the wound is hidden within the natural eyelid fold. Next common question: will the double eyelid crease last forever? The results of incisional blepharoplasty are generally long-lasting, and for most patients, the double eyelid crease will remain permanent. However, natural aging, skin elasticity, and lifestyle factors can affect the eyelids over time. While the crease itself won't completely disappear, some patients may notice subtle changes in its definition as they age. Maintaining good skincare and overall eye health can help preserve the results for as long as possible. Another common question: how long will the recovery period be? Recovery typically takes about 1 to 2 weeks, where swelling and bruising are more noticeable, and it gradually improves over time. Most patients feel comfortable returning to daily activities within 7 to 10 days, although full healing and final results may take a few months as residual swelling subsides. I usually recommend my patients to avoid any strenuous activities and heavy lifting for at least 2 weeks to 4 weeks to ensure proper healing. And that wraps up the top 5 questions I get about eyelid surgery. If you are considering eyelid surgery or want to learn more about your options, reach out to us at Eagle Aesthetics and Surgery for more information. Thank you for watching, and make sure to like and subscribe for more aesthetics, oculoplastic, and plastic surgery insights. See you soon!